This is Parenyato Hospital, one of the biggest state-run hospitals in the country. It's normally busier than this, but for more than 2 weeks, doctors have been on strike, nurses have been on strike, midwives are still on strike. They're calling for better working conditions and more money. They say they can't survive on the salaries that they're earning.
I cannot afford to pay medical bills for myself. Like you see, the services that I provide, they're out of reach for me. If one of our junior doctors gets sick, usually we have to congregate as a group, make contributions in order to help.
We've managed to get inside some of the hospitals. It is fairly quiet. There are a few doctors working, a few nurses who are working, but the doctors who are working seem to be the senior doctors, the senior nurses, and some army doctors have been called in. There's been a shortage of money for many years in the public health sector, and some drugs are running out. Patients are being turned away.
It's quite sad inside the hospitals in terms of patient care. There's only a few doctors who are working, and it's quite overwhelming, given the fact that the doctors who are working are not quite accustomed to the duties they are carrying right now.
So while most health facilities have been brought to a standstill, President Robert Mugabe is in Singapore seeing his doctors, a move that has angered some Zimbabweans here.
To have our own president being the first person to leave the country to seek medical attention outside the country, it just shows that he himself has no confidence whatsoever in the country's health delivery system. But he expects the majority of the people who, as you know, 75% of the people of Zimbabwe are surviving on less than $2 per day, to go there in the public hospitals, in the public clinics where there are no medicines because of the shortage of foreign currency. But look, does he care? He doesn't.
Government officials saying to people, don't give up hope. They are in talks with the striking doctors, striking nurses, striking midwives, trying to convince them to come back to work. But all those people on strike say they aren't coming back to work until the government promises them they'll get more money and their working conditions will be improved.